And you mentioned alongside that, inflammation also has an impact on cardiovascular functioning and health. I believe it's the case that cardiovascular disease is the biggest killer in the world, from what I understand. So I was wondering if you knew any of the stats that show the impact or the increased likelihood of me having a heart attack or a stroke or something based on my oral microbiome.
So the research has shown that if you have gum disease, you are at a 20% higher chance of high blood pressure. But also they are now saying that up to 30 to 40% of cardiac issues in hospital can be traced back to an oral bacteria causing problems in the heart valve. So the reason for this connection, so yes, inflammation, but also going back to that third mechanism I told you, which was about the vasoconstriction, so the blood vessels constricting and dilating. So these toxic enzymes, which are being released by the bacteria, they travel through the blood, and they basically stop the blood vessels from being able to widen and lots of blood to travel to the heart and also to constrict. And that also is one of the biggest connections with heart disease.
I found this stat, which might well be from your work or someone else's. It's from the study called The Association Between Periodontitis and Blood Pressure Highlighted in Systemically Healthy Individuals.
Not mine, but...
Okay. And it found that people with gum disease were twice as likely to have a heart attack and 3 times as likely to have a stroke than those without inflammatory gum disease, which is absolutely staggering.
Yeah. And then another study also showed that when you treated someone's gum disease, their levels of CRP, and CRP is an inflammatory marker that you can check in your blood, the levels of CRP significantly reduced. And for a lot of patients who suffer from heart conditions, they will get their CRP quite regularly checked through blood testing. Mm-hmm. And so this is a way of reducing their inflammation is just by having a simple hygiene. And I've even seen, particularly in America, there's a lot of cardiac surgeons and doctors related to heart health who are now actually working with dentists because they understand that if they work together, then they're going to have far better results for their patients.
And this is that swallowing thing we were talking about. This is because you're swallowing that bad bacteria.
Yeah, and your heart valve, imagine if it's faulty, imagine you just had surgery. I always think of it like it's sticky. It's like Velcro. So it's really prone to infection and problems. It's just like if you fell over and you had a scab and you were rolling around in mud all the time, you would get bacteria going into that scab and causing problems. It's the same thing with your heart valves.
Doesn't the bacteria just travel on its own anyway? Because I feel like it's in my mouth. So I feel like I don't know, these are living organisms. Don't they just like find their way down, even if I don't swallow?
Yeah, even through your blood. And also through your gums as well. So you can swallow your bacteria, breathe it, or it can go through your blood.
At the start of this conversation, you mentioned the sort of implications for your cardiovascular system. And one of the things you said was erectile dysfunction. And that was slightly alarming to me as a man who's trying to stay away from erectile dysfunction. What is the research that supports this idea that my oral microbiome can have an impact on my erectile functioning?
So men who have periodontal disease are 2.85 times more likely to suffer from erectile dysfunction.
2.8 times?
Yeah.
I'm pretty sure that's 280%, isn't it?
Yeah.
Okay, so what is this periodontal disease?
Gum disease.
Okay.
So it's kind of, I would say it's a bit of a spectrum. So the early stages of periodontal disease or gum disease is just gum inflammation. So that's that patient who is brushing their teeth, spits in the basin and sees blood. So that's the original, the early inflammation. If they don't get that checked out and sorted, that will just continue and continue and continue to what we call gum disease. And that's where, yes, you've got inflammation, but actually you have really high levels of bad bacteria now. And this bacteria is essentially eating away the gums and also your bone. And it's now become irreversible.
I'm just going to have a swig of this.
For your erectile dysfunction.
Yeah. Fucking hell. Okay.
And then at the very end of the spectrum is people who are losing their teeth, having really terrible gum infections, and all of these kind of mouth-body connections that we're talking about.
Okay. And can you just explain, as if I'm 10, how that gum disease, that periodontitis, is it called? Mm-hmm. Has an impact on my penis? I don't understand. I don't understand the link. It makes all of my blood vessels...
Exactly. Yes. Okay. So it essentially stops your blood vessels from dilating. Mm-hmm. And so you've got reduced blood flow to your penis.
Okay.
And therefore... doesn't work.
Okay, so this is an emergency, this stuff. This is really is important.
That's the one statistic. Whenever I have a man in the chair and he's like, oh, I don't want to brush my teeth, I'm like 2.85 times more likely to have erectile dysfunction. They usually will go straight to the bathroom to brush their teeth.
The other thing, but it's true, but also the other thing that I read in your research, which I found really, really shocking, is the link between my oral health, my oral microbiome, and cancer.
Yeah.
I was reading specifically about female breast cancer, which I know affects a lot of women. What is the link there between breast cancer, cancer generally, and our oral microbiome?
So this is, I would say, some of the newest emerging research that's coming out. So with breast cancer, I didn't know this before this research came out, but your breast has its own microbiome. So that tissue within the breast, different bacteria are able to grow. And what they found was that in women who had breast cancer, they had high levels of certain oral bacteria in their breast microbiome. So the oral bacteria is called Fusobacterium nucleatum. And they compared the breast microbiomes of patients who didn't have breast cancer versus those who had breast cancer.
Sorry, what's a breast microbiome?
Just the collection of bacteria in your breast.
Okay.
Yeah. I didn't even know there was a microbiome in your breast either, but apparently so. Okay. And so when they compared a healthy woman, her breasts, to a woman who had breast cancer, the woman who had breast cancer had very high levels of the specific oral bacteria called Fusobacterium nucleatum in their breast. There's also been research on colorectal cancer. And actually, Apple News came out with something a couple of months ago, which was nice to see them kind of just spreading the word. But what they found was that in patients who had colorectal cancer, more than 50% of them had the exact same oral bacteria from the breast cancer study, that Fusobacterium nucleatum, in the colons. And what they found was that oral bacteria made the cancer more aggressive and harder to treat as well.
I was reading about a study in mice that linked that oral bacteria to tumor growth. Mm-hmm. Are you familiar with that study?
Yes, and it's that specific oral bacteria, so the Fusobacterium nucleatum, which has been shown to accelerate tumor growth within mice, but also for colorectal cancer and breast cancer as well.
And what's your belief there? I know this research is fairly new, but do you think there is a causal relationship, a significant causal relationship between the health of our oral microbiome and our probability of developing some form of cancer?
I wouldn't yet say causal. I think that for most cancers, it is multifactorial, and there are a lot of things that can impact whether or not you get the cancer and how aggressive the cancer is. I do think that oral health and some specific oral bacteria are risk factors and can definitely increase the aggression of those cancers or even the initiation of them. There's also been research, and I think I'm waiting for the research to be published, on what they're doing is they've created a antibiotic which only kills that oral bacteria that I was talking about, so Fusobacterium nucleatum. And they are going to be issuing that antibiotic to those patients who have the colorectal cancer, which has the oral bacteria, to see whether or not it slows down their progression or improves their prognosis. So if I see those results and it shows it, then there's for sure a strong causative link between the two. But for now, I would say that it's multifactorial and it's definitely a risk factor.
That oral bacteria that you're describing, that you called it Fusobacterium?
Yeah.
What is it that causes that? Is it something that I'm eating? Is it a lifestyle choice I'm making?
Multiple things. Poor oral hygiene. Some of us genetically will have higher levels of it. It's what we eat. It's who we're kissing. It's what we're breathing in.
Does my girlfriend have it?
So we would have to see.
Okay.
But it's, and that's the thing, that's the beauty of being able to test these things now, is that you can actually see. And also it's strange is that green tea, something so simple is extremely effective at killing Fusobacterium nucleatum. So it's just knowing those types of things, being able to do the test, knowing the right treatment plans and recommendations based from that. We know green tea is good for us, and now we can really understand why.
Okay, that's interesting. You have actually tested Jack over there, right? And you said to me before we started recording that he's got a ton of that Fusobacterium.
Yes, he does. Yeah.
And it's really getting out of control. That's what you said.
Really badly out of control.
Jack
Yeah.
Sylvester.
So I've I've given him a big vat of green tea as a gift.
Green tea?
Yes.
Green tea. This guy's going to edit that out. This is the problem.
Yeah.
Green tea.
Yeah.
That's good for my own microbiome.
Yeah, really good.
How?
Stains, but really good. It's anti-inflammatory. It helps with what we call oxidative stress. So this is basically stress for the body, and it's antibacterial. So it actually is very effective at killing Fusobacterium nucleatum.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.